Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Finding a caregiver for a loved one can be stressful. There are several different types of caregivers to choose from that all provide different levels of care at different price points. Today, we're going to be talking about the many types of caregivers and the differences between the types of care that they provide. We'll begin with the 5 types of in-home caregivers before moving on to the other 5 types of caregivers. Now, let's move on to the rest of the show. Before we jump into the types of caregivers, let's briefly talk about what a caregiver is. Hopkins Medicine tells us, in simple terms, a caregiver is a person who tends to the needs or concerns of a person with short or long-term limitations due to illness, injury, or disability. The term family caregiver describes individuals who care for members of their family of origin, but also refers to those who care for their family of choice. This could be members of their congregation, neighbors, or even close friends. Family caregivers play a significant role in healthcare, as they are often the main source of valuable information about the patient. Most people will either be caregivers or need care at some point in their lives, and oftentimes they will experience both sides. According to the Family Caregiver Alliance, family caregivers, particularly women, provide over 75% of caregiving support in the United States. In 2007, the estimated economic value of family caregivers' unpaid contributions was at least $375 billion, which is how much it would cost to replace that care with paid services. Family Caregiver Alliance says that caregivers tackle a wide range of tasks. They may do household chores like buy groceries, cook, clean the house, and do laundry. They may also help with personal care, like helping a family member get dressed, take a shower, and take medicine. They can also provide medical-related assistance, like helping transfer someone in and out of bed, help with physical therapy, injections, feeding tubes, and other medical procedures. They can also help a loved one make medical appointments and drive to the doctor and drugstore. Many caregivers are the go-between for their loved one and are the ones that talk with the doctors, care managers, and others to understand what needs to be done. They also spend time at work handling crisis or making plans to help a family member who is sick and is often the designated on-call family member for problems. Now that we've had a refresher on what a caregiver is and the importance of a caregiver, let's move on to the types of caregivers. There are 5 types of in-home caregivers: family caregivers, informal caregivers, independent caregivers, private duty caregivers, and professional caregivers. Each of these types provide in-home care, but the way they provide care differs. Caregiving can be expensive, and many families are more comfortable doing at least a portion of the caregiving their loved one needs themselves. According to Jev's Care at Home, family caregivers are usually unpaid family members who take care of a spouse or a loved one. These caregivers are almost always related to the person receiving care in some way. And we are often asked if it's possible to have some of your caregiving expenses reimbursed. It is, but on average, about 21% of all caregivers' work is unpaid. And that said, you may become a paid family caregiver by working with a home care company. You may also find local resources to help with the cost of caregiving. According to Family Caregiver Alliance, sometimes caregiving families may obtain financial relief for specific purposes, such as for respite care or to purchase goods and services, and in some cases, pay for caregiving. In some states, there are programs that pay family members to provide care to those receiving Medicaid, and in very few states, there are programs available to those who do not qualify for Medicaid. It is important to note, though, however, that these programs vary widely, often with complicated criteria for eligibility. The second type of in-home caregivers are informal caregivers. Again, according to Jeff's Care at Home, informal caregivers provide similar services to those of family caregivers, but in most cases, they aren't related to the person receiving care. Usually, these caregivers have some connection or relation to their clients, which is helpful for creating the companionship many seniors seek. According to Family Caregiver Alliance, about 44 million Americans provide 37 billion hours of unpaid informal care each year for adult family members and friends with chronic illnesses or conditions that prevent them from handling daily activities such as bathing, managing medications, or preparing their own meals. Many people act as informal caregivers without even realizing that's what they're doing. Neighbors, friends, and family members provide informal care through tasks like meal prep, transportation to appointments, and errand assistance. They may see these tasks as just helping out when they are really providing care. The third type of in-home caregiver is an independent caregiver. According to Jeff's Care at Home, an independent caregiver gets hired directly by the person's family needing care and is not affiliated with a home care company. They provide all of the necessary caregiving services and work with the family to determine their loved one's care needs. This also means there are higher risks and liabilities when choosing this route. Independent caregivers can often be 30 to 40% cheaper than a home care company and have fewer restrictions than a professional caregiver does. Paying for Senior Care says that as of 2019, if an independent caregiver is paid more than $2,100 per year, they are now considered a household employee and not an independent contractor. Thus, the family hiring the independent caregiver takes on all the responsibilities of being an employer, which includes payroll and taxes and all other requirements. As the employer, you would write a job description for a potential independent caregiver that covers the level of care and all care tasks that will be expected to be performed. Paying for Senior Care suggests listing tasks such as driving or accompanying the senior to and from appointments, running errands, providing supervision and companionship, managing medication, assisting with bathing and grooming, preparing meals, and house cleaning. The personal qualities one is seeking in a caregiver should also be covered, such as a patient individual with a cheerful, upbeat personality. Independent caregivers can provide medical care, but they are often only providing personal care. The fourth in-home caregiver, a private duty caregiver, is similar to an independent caregiver. According to Jeff's Care at Home, private duty caregivers typically work for a home care company or independently and alleviate the difficulties of everyday life for a senior to allow them to continue living independently in their home. Depending on their level of training, a private duty caregiver is able to provide medical, nursing, cleaning, personal, domestic, and transportation services. And the last type of in-home caregiver is a professional caregiver. According to Jeff's Care at Home, professional caregivers are career caregivers, so their primary occupation is caregiving. These caregivers work with a care recipient either in their home or in a facility to ensure they receive proper care. Professional caregivers work for professional home care companies, so they are typically assigned when you hire the company. They provide everything from homemaker services to medical care if necessary. Professional caregivers work through licensed companies and oftentimes provide more care than the other four types of in-home caregivers. And because of this, a professional caregiver costs more than the other caregivers do, roughly 30 to 40% more. Using a home care company means that you would not have to take responsibility as the employer like you would for an independent caregiver. Now that we've covered in-home caregivers, let's move on to the other types of caregivers you should know. Hospice caregivers are up first on our list. Hospice caregivers can provide care both at home and in a facility. Hospice caregivers can be family members or professional caregivers. According to the National Institute on Aging, hospice care focuses on the care, comfort, and quality of life a person with a serious illness who is approaching the end of life. A hospice caregiver provides the necessary care for your loved one, while also making sure they are as comfortable as they can be. A hospice caregiver is often part of a team. Compassus says that the hospice team arranges for the delivery of medical equipment and medications. They work with you on a schedule for visits from the nurses, therapists, chaplains, social workers, and volunteers. The schedule adapts to your needs. According to Compassus, the responsibilities of a hospice caregiver include helping patients with the activities of daily living, including bathing, dressing, feeding, and going to the bathroom. Ensuring your loved one has their prescriptions and all that medicines are given at the correct dose and time. Hospice nurses and aides can also teach proper techniques and provide basic medical care, including changing dressings, taking temperatures, and blood pressure readings. Hospice caregivers also understand how to use medical equipment, which may include oxygen machines, wheelchairs, lifts, and hospital beds. However, depending on the hospice provider and even the state that you reside in, most hospice caregivers will visit 1 to 2 times a week and for a short duration of time. Many times for families receiving hospice at home, the hospice provider will recommend hiring a home care company to help with the loved one's needs. If your loved one is receiving hospice care at home and needs to be transferred to a facility for pain management or any other reason, the hospice team will schedule transportation to the facility and will continue to provide care for your loved one and your family. There may be times when your loved one is home alone and needs care, and it may be unsafe for a caregiver to come to the home, or a caregiver may be unable to visit. According to Jeff's Care at Home, that's where virtual caregivers come in. By using a tablet or other type of screen, caregivers interact with their clients through Skype or another form of video call to ensure their health is being monitored. This type of caregiving should be supplemental to in-home caregiving, but still, helping caregiving, like with medication reminders or health screenings, it's also helpful for companionship. There are also technologies available that allow a virtual caregiver system to monitor your loved one in their home, like Addison Care. According to Addison Care, Addison, the virtual caregiver, is a state-of-the-art 3D animated, connected caregiver designed to transform a residence into a digital smart health home, providing chronic care management, rehabilitation, aging in place, behavioral health, and care coordination for patients of all ages. With a virtual caregiver system, you can connect devices such as glucose monitoring, blood pressure cuffs, and thermometers. The system can send alerts to you and your loved one and provides 24/7 support. Similar to Life Alert, if your loved one falls, a virtual caregiver system will notify emergency services. Virtual caregiving, even a system such as Addison Care, should still only be used as supplemental care and should not replace an in-person caregiver. Companionship is an important aspect of the caregiving relationship, and it can be supplemented with virtual visits, but cannot be replaced by it. Another caregiving option for your loved one that cannot be home alone is adult daycare. According to Jeff's Care at Home, adult daycare offers the opportunity for seniors to have stimulating social, cognitive, and physical activity outside of the home for a portion of the day. If it's possible, your loved one may be unsafe alone, can't perform daily activities, and is alone for most of the day, adult daycare may be a good option. These programs typically supplement an in-home caregiver, usually in situations where a family member who is also the caregiver has another job. Not all daycare centers are the same. According to the AARP, most offer therapeutic exercise, mental interaction for participants, social activities appropriate for their condition, and help with personal care such as grooming and using the bathroom. Adult daycare centers differ in the specific areas of care that they offer. Social centers concentrate on meals and recreation, while providing some health-related services. Medical and health programs provide more intensive health and therapeutic services in addition to the social activities. And specialized centers take participants who have only a particular condition, such as those diagnosed with dementia. Depending on the type of care you are looking for and the length of time your loved one will be staying at a center, prices can vary. On average, adult daycare costs $70 a day. Medicare does not normally cover the cost of adult daycare, but you may find financial assistance in your area. Some veteran services may help cover the costs, and local and state programs may also help pay for adult daycare. The AARP suggests looking into adult daycares when you start seeing signs that an older loved one is unable to structure their own daily activities, when a loved one feels isolated and lonely and wishes for interaction with other older people, or experiences anxiety or depression and needs social and emotional support. You may also want to seek daycare services when your loved one has difficulty starting and focusing on an activity, whether it's conversation, reading, or watching television, when they seem to be no longer safe on their own or feel uncertain and anxious about being alone. Family caregivers also might consider adult daycare services when they need to work or be away from home for most of the day, or if they are themselves experiencing ill effects, such as anxiety, frustration, depression, or health problems. Your loved one may be mostly independent and able to live alone, but still need a caregiver to stop by for things like medication assistance. Assisted living may be a good choice if this is true for your loved one. According to Jeff's Care at Home, assisted living facilities come in all shapes and sizes, but are typically designed to provide a very basic level of care and their assistance to their residents. These facilities offer social activities, a community setting, and other services to enrich the lives of those living there. Outside of these services, care is provided periodically and as needed, like in the case of administering medication. The assisted living staff provides care as needed and not constantly like in the case of a caregiver. In addition to standard assisted living facilities, there are also specialized facilities or sections of the facility that work primarily with those who need more care. These sections are typically for those with injuries, chronic conditions, or diseases like Alzheimer's or dementia. Many families choose assisted living facilities in order to help with daily living activities. Daily living activities are things that you do every day, like eating, bathing, and walking. For elderly loved ones that need help with a few of these activities every day, but do not need help with the rest of their activities, assisted living would be the perfect option. For example, if your loved one needs help walking around and getting in and out of the tub, but they can make their own meals, eat alone, and dress themselves, assisted living would allow them to maintain their independence while still having a caregiver's help. And Medicare doesn't usually cover any of the costs with assisted living either, but just with the other types of caregivers we've talked about today, local agencies and services may be able to help cover some of the costs of care. Visit your local senior center to find out what programs are available in your area. Assisted living facilities do not provide full-time care for your loved one. If your loved one needs full-time care outside of the home, a nursing home or a skilled nursing facility may be the type of care your loved one requires. According to Where You Live Matters, in a skilled nursing facility, residents receive full-time care by a specially trained medical staff. People who require a higher level of medical care, either short-term or long-term, need what's known as skilled nursing care, extended care, or long-term care. These facilities are licensed by Medicare and Medicaid and are focused on short-term rehabilitation and long-term medical care. According to the National Institute on Aging, nursing homes focus on medical care more than most assisted living facilities. These services typically include nursing care, 24-hour supervision, 3 meals a day, and assistance with everyday activities. Rehabilitation services such as physical, occupational, and speech therapy are also available. Some people stay at a nursing home for a short time after being in the hospital. After they recover, they go home. However, most nursing home residents live there permanently because they have ongoing physical or mental conditions that require constant care and supervision. When choosing a nursing home, make sure you know what type of care your loved one needs and find a place that specializes in that care. Nursing home staff have many patients they are taking care of, and especially with the ongoing COVID-19 pandemic, it's important to make sure your loved one is getting the care they need. We've talked about the importance of advocating for your loved one before, and that still remains here. When your loved one is receiving care not at home, there is always a possibility that their care needs are not being met 100% of the time. Being an advocate for your loved one in a facility means regularly visiting your loved one and staying up to date on their care plan. Having a relationship with their care team can also make it easier to stay up to date on any changes that happen with your loved one while they are in the facility. When choosing a nursing home, you should look at reviews, talk to friends and family members that have experience with the nursing home, take a tour of the facility, and ask about wait lists for the facilities in your area. Nursing homes can be difficult to get into, especially with the continuing rise in the aging population. When touring nursing facilities, the National Institute on Aging suggests looking for Medicare and Medicaid certification, handicap access, residents who look well cared for, and warm interaction between staff and residents. They also suggest visiting a facility a second time without calling ahead. Try another day of the week or time of day so you will meet other staff members and see different activities. Stop by at mealtime, and while you're there for this second visit, you should see if the dining room is attractive and clean and if the food looks appetizing. We've now covered all the various types of caregivers. Choosing the right caregiver for your loved one is an important task that shouldn't be taken lightly. If someone you know is currently looking into types of care for their loved one, share this episode with them. Knowing what types of caregivers are available can help you make a more informed decision when it comes time to choose the type of care you need. If you or someone you know is a caregiver, visit our YouTube channel and our dedicated caregiver support playlist for episodes to help the caregiver. We want to say thank you for joining us here today at All Home Care Matters. All Home Care Matters is here to help families navigate these long-term care issues, and we invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can leave us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms and watch the show on our YouTube channel. Just make sure to hit that subscribe button so that you never miss an episode. We look forward to seeing you next time here at All Home Care Matters. Thank you.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, Visit us at allhomecarematters.com.